It's juvenile idiopathic arthritis. It's arthritis in kids. JIA is a catch-all for all the different arthritides that don't have another reason. There's multiple different kinds of arthritis in there. There is definitely a genetic predisposition, but it's a multi-genetic thing. With juvenile arthritis, you could have propensity for having arthritis, but something triggers it. A lot of times we do know what that trigger is, but a lot of times we don't know what all the different genes are. We see growing pains, and sometimes they're truly just growing pains, and other times there's something more going on. Growing pains are basically at night. Not exclusively, but if they're happening during the day, then it requires some workup to rule out other things. When you have inflammatory arthritis, the inflamed joint stiffens up when you're not using it. So first thing in the morning, if your child is limping or walking funny and then seems to kind of loosen up and move normally after they've kind of got going, that's an indication of an inflammatory arthritis. And that's different than pain during activities. The mainstay for juvenile arthritis actually still is non-steroidal anti-inflammatories. It's the first thing that we start with, and a lot of patients, that's all they need. 50% of juvenile arthritis will go into adulthood without arthritis, not on medication, in remission. There are some subtypes where they're more likely to go on to adulthood with arthritis, but even those patients, we have treatments. We have good treatments that are able to be taken long term, and there's new medications coming out every year. Here I definitely see the person as a whole, and I think that's something that's more than just me here at Tufts Children's Hospital. I think that there's a lot of different specialties that see the whole child. My name is Trevor Davis. I'm a pediatric rheumatology attending here at Tufts Children's Hospital.